now I'd like to go through the 10 things that I've learned uh, during the pandemic, either in the hospital or in my own life. The first is authorized is not approved. I didn't never had noticed the difference. I was familiar with emergency use, but I never noticed that authorized and approved were two different things. And I think we sometimes use those terms interchangeably, and they're actually different. And that was something I didn't know. I've also learned that there's such thing as blueprints and there's scrambles. And during the pandemic, we've had some things that were blueprints where we knew that it was going to happen. We had a previous policy, we executed upon it. And then other things were just a scramble. And some days it seemed like a scramble all day, every day. But if you got a good team around you, those scrambles are pretty easy to execute upon, particularly if you have the guiding principles. And we did have four guiding principles: was to protect patients, preserve the healthcare system, uh, reduce spread of the contagion, and to protect our staff. And so if you have those guiding principles, it's easy to create a scramble. And I think multiple times I was pretty proud of how we handled situations as they came at us. The third thing I learned, pangolin. I did not know what a pangolin was. It is a scaly anteater. It is the only mammal with scales, and I had no idea that a pangolin exists, and now I do. The fourth thing I learned, Chick-fil-A. People love Chick-fil-A. You may know, some of the listeners may know, my wife Tanya works in the foundation, St. Luke's Foundation. They coordinated food delivery, and so I helped her on multiple occasions deliver in the evenings back to the hospital when local restaurants would donate food, and then we would take it to each unit. And man, Chick-fil-A really made people happy. So if you're going to eat a chicken sandwich, I highly recommend Chick-fil-A. The fifth thing that I learned is we didn't have a hierarchy of recommendations. So when we were going through the pandemic, I think we made the mistake of one category or recommendation we were following was the WHO, the World Health Organization. The next was the CDC. The next was the FDA. The next was what the state said. The next is what maybe the American College of Gynecology, Obstetrics and Gynecology, what they said. And that those disparities were hard to keep track of. And as a medical staff, we would be taking a poll at the end of the pandemic, or in coming months at least, to say, okay, I'm just giving an example, we're a WHO medical staff. And then if the WHO doesn't have an answer for us, we go to the CDC, and then maybe the next, and then maybe it's the colleges and the universities of particular medical specialties that publish papers, etc. So we have a hierarchy of making those decisions rather than having this just chaos of CDC, state, WHO, that it was really confusing. It was hard for people to follow. The sixth thing I learned, number 6, COVID is not influenza. At the beginning of the pandemic, there's a lot of comparison of COVID to influenza, and people were making decisions based upon how influenza behaved, the flu season, etc. It's going to be a bad flu season. You heard those terms thrown around, and I think learning during that COVID it's a different virus. It's different than influenza, and other than it causes a respiratory illness and it's a virus, there's not a lot of similarities between the two. Influenza certainly is more droplet, where I think it's, in my mind, definitive. COVID at times is opportunistically, depending on the right scenario, is actually airborne. And I think that is certainly something I'm taking forward from this, that I'm not going to compare influenza and COVID as I make decisions. The seventh thing I learned, Mother Nature will humble you, and will always win. That we try to predict the virus at times, and you're wrong. You say it's going to do this, you think it's going to do this based upon this, and it just doesn't. And so I think it makes you stay humble, which is always a gift, I guess. But Mother Nature just has a way of just moving forward. And I like to tell this story. So next to the hospital is Cargill, and they corn and soybeans come in there, of course. And I believe this is a corn plant. And so one of those trucks going back on 380 to head north, at some point a kernel of corn dropped into the crack in the sidewalk, or excuse me, in the road, and a stalk of corn grew. And I always would drive by that in the day and think, man, just the life force, Mother Nature just goes on, and it's relentless, and it's going to keep going on, and you need to recognize that and respect that. The eighth thing I learned was air circulation is important. Never really thought about air circulation prior to that. I knew that our surgical rooms cycled the air at a greater frequency per hour than the other rooms. Other than that, I really had no idea. And learned a lot, read a lot about air circulation and how that is thought through, and how some of the, in third world countries or the tropics, how they built hospitals was so they had good air circulation and air movement. Stagnant air is concerning because that may allow the virus to be suspended longer and then subsequently increase the transmission. The ninth thing I learned is have early interventions. Early on we waited until people were low on oxygen before we put them in the hospital, and we didn't have early therapeutics at our disposal. And I've learned that that's something that's very important. And even if we have to do it locally to put together a protocol, but we should do a better job putting together a protocol earlier. The guidelines for treatment weren't published until October 2020. And so that was well into the pandemic. And fortunately, they're published prior to that peak that we had in November into December of 2020. But it felt like they came late. And it felt like with the power of our academic medical institutions and our private hospitals and medical institutions, we should have had a protocol for treatment earlier than what we did. And the 10th thing that I learned, and unfortunately observed to be true, is routine healthcare is important. When we had the lockdowns, we suspended routine healthcare. And that contact with your clinician that takes care of you and the specialists that take care of you, it is important. And when you suspend it like that, it causes a tsunami effect that comes later as diabetes and cancer and heart disease. Those all continue to progress, and it just lands in your lap someday. And that's one of the reasons why we've been so busy. And so routine healthcare is important. And if I wouldn't make that mistake again, I would keep things open and keep moving along with routine healthcare and maintenance healthcare, particularly diagnostics to screen for cancer and heart disease. That was the 10 things I've learned. I've learned other things, but those are the 10 that I felt the most perhaps unique, but certainly worthy of learning and knowing about them and going forward. You notice I didn't make any reference to healthcare workers are really superheroes, and because I didn't learn that, I already knew that. The pandemic just revealed to me or confirmed to me what I've always known, that nurses, respiratory therapists, physicians, techs, laboratory personnel, radiology personnel, they're dedicated and they go above and beyond every day, regardless of the circumstances, to get the job done. And I'm very thankful. I work with a tremendously good team, and we'll be ready for the next pandemic, but we'll also finish out this pandemic strong.
Thank you for listening to Live Well Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.